Hello again? Yeah, okay, now it's okay. Okay, good. So we are almost arriving to the end of this symposium. But before arriving to the end, we want to bring something to light. So it's something that we all know. So we all know how vets are suffering, right? So Maria was talking about this yesterday as well. And from Purina, we don't want to give our back to these vets that are suffering, to the families that are suffering a lot as well with them. We don't want to be silent. So I think we have been a lot of time silent, not us in general, the society, and we have to start to be loud. And for this reason, we couldn't, let's say, close this symposium without having with us an expert that is a vet as well, and that will talk us about these mental health issues and some key data that I think will be very, very important for all of us to know and to start being more loud as well. So I'm going to introduce you to Miguel Moura Esteves. He's a veterinary surgeon with clinical experience in reference hospitals and first opinion setting, both in Spain and Portugal, and corporative experiences within pharmaceutical industry in marketing, technical management, quality, and pharmacovigilance. He's a neurolinguistic programming trainer and a certified coach, currently studying to become a person-centered counselor and psychotherapist. And currently he acts as a trainer and facilitator in communication, emotional management, effective leadership, and individual and organizational resilience. So it's a pleasure for us to have you here, Miguel, and please join me to welcome him to the stage.
Thank you. Thank you very much. How does this? So just move on. Okay, I was told I couldn't move very much, so I have the problem that Marta has. It's going to be tough. I think I will, if you don't mind, I will just step here. I'm closer to you. So, good afternoon, everybody. I hope you enjoyed your day. This day has been thrilling for me. I'm always happy to be surrounded by curious minds, so it's always good to be in this kind of settings. So the idea for this lecture today, I don't see anybody. This is really horrible. The idea for this lecture, we thought that we wanted to pass you a little bit of information, of course, of what's going on and what do we know, what's the research on mental health. But we also wanted to give you something useful in your roles as experts that have to deal with colleagues, have to deal with owners. And so this is going to be a two-part kind of speech. So we're going to go through the literature that we have already, and there's a lot of things, and all the time is happening new research. So we're in a very good moment in this mental health research. And then we will look at what can we do individually and what can be done collectively. Of course, we need both strategies if we want to take care of this issue. And today I would focus individually on what you can do as an expert or as someone who has to deal with a lot of people around you, and then I will share with you some tools that are available that may be useful in some cases for you to look at. So, what do we know so far? Oh, this vibrates. So there's a lot of studies in a lot of countries. We have studies in Spain, we have studies in Italy, we have studies in Austria, in Portugal, and this one for us, for Portuguese people, was quite a splash when it came out because the numbers are very bad. I will go into the numbers later. We have studies in France, and then we have international studies that try to cover a lot of countries and try to see if there are differences among countries, among different markets. And we do see some differences, and some of the stressing factors are different depending on the country you're looking at. But the main results are quite similar. So what we have, compiling all these research into, it's not easy to compile all of that, but more or less I could sum it up. So usually what we have, does this point? No, it doesn't work. We have a quarter of the vets showing symptoms of burnout. So it's 1 in 4 vets have symptoms of burnout. So it's a lot of people nowadays. We have up to 20% report of suicidal ideation in some markets. So 20% of vets think about ending it all, which is sad, a sad reality. In Portugal, this was the study I was talking about, and in France, we have reports of suicide attempt once in their life. So in Portugal, I don't remember the numbers for Spain right now, but for Portugal, they interviewed 833 professionals, in veterinarians, nurses, all the sector, and so 3.5 is 29 people that said that they tried at least once to end their life. Thankfully, they didn't because they answered the survey, so they're good. But it's still a lot of people. And 90% of vets report being stressed, as I'm sure you would report as well. And 23% had to take a medical leave due to mental health issues in the past 12 months. So these numbers are not great. There are some studies as well that look at the economic cost of all of this, because this actually moves businesses. No, if you identify a problem and you see how much does it weigh in your business, then it becomes more relevant. And what they found out, this was a study from 2022 in the American market. What they found out is that the cost of burnout, and what I mean the cost of burnout is the leaves, the having to rehire people that leave practice, all the costs associated with this problem amounted to up to 4% in lost revenue. This means for the American sector at that time, of course the European reality is a little bit different, but at this moment it was like $2 billion of lost revenue due to mental health, which is a big number. And so I think I usually even start the lectures with this study, because this, for me, was the tipping point where the industry really woken up and said, okay, we need to do stuff, because we're actually losing our ability to maintain ourselves as a business, and we will not be able to take care of animals if this keeps going. Then we have the study from Purina, which actually uncovers similar results. We have 76% feeling overwhelmed. Leaving the practice is a common consideration. And all the studies present numbers similar to this, not so high sometimes, but it depends also. I think we need to look at mental health research with our clinical eye. And we know sometimes when we do surveys, the people that will respond to these surveys is someone that is actually more prone to this subject and more has a bigger affinity to this subject, and sometimes the numbers can be, but it's difficult to measure and counteract this. But anyway, just to have that notion. What's interesting is that vets want a mental health aid. So when asked, they say they won't help, and also they report needing help in soft skills training, which is something that is now happening, and now most universities have small seminars or lectures in communications skills or emotional management skills. So soft skills training is something that vets really need, and if you're working as a vet, you understand this is needed. But during the university, most of us, we didn't get any training whatsoever. And so we end up in the practice dealing with people and having no idea how to deal with people. So this is interesting. So the common findings, to sum it all up, so high levels of burnout. This is interesting. Client-related stress is usually higher than animal-related stress, so we suffer more from dealing with people than we're dealing with the animals, which is interesting. Women have worse results than men, and in a profession that is dominated by women nowadays, of course, our results are worse than if they were half-half. Age and experience inversely correlate with the burnout, so as we get older and experienced, we are more protected from burnout, and it's easy to understand now. We've been through more things. We relativize. I don't know if we put it in the scale, and it's not so important. And this, for me, creates a lot of opportunities to cross-training from more experienced vets to younger vets. So there's a lot of opportunities to support these younger vets that are coming into the profession and that need some extra help to deal with all of this, that after some years you're a bit more resilient to deal with them. And then this is the data that for me worries me the most, is that we see in a lot of studies a loss of empathy, not only towards the client, because that usually goes out the window very quickly, but towards the animals as well. And if this happens, we're not really veterinarians anymore. So this is something that worries me a lot. And so the situation is, this is the sad part of the lecture, then we'll go to more happier parts, but the situation in the sector is really not good right now. It has been worse, so there are some studies that show improvement. I will talk to that about that in a minute. But it's important to understand why is this happening, and I think some of the reasons you all recognize and you've all experienced yourselves. So long working hours, the low income compared to other health professionals, the insufficient development opportunities. There are many small practices that are doing the same thing for years and years and years, and so people get tired and bored, honestly. Work overload, lack of mentorship and feedback. This is one of the critical aspects. I was very fortunate, and then when I started, I had like an informal mentor. It was not formal, but I had an informal mentor that helped me through the beginnings, and that changed completely my way of looking at veterinary medicine. But when this is not present, is a problem. And so this is why I think more experienced vets can play a role in helping these younger vets to deal with the beginning of the career. Lack of autonomy and own workload and hours, and of course we know this very well. So things keep coming in through the door, and we really don't know how to manage all of that, and we do the best that we can. Challenging client communication and client expectations. This is a major one. So usually we have problems when people think that something is going to happen and it's not what's going to happen. And if we're not able to explain what is really going to happen, then start the complaints, the lawsuits, the money, enfin. Poor work-life balance, we all know this very well. Student debt in some countries, because in some countries the university is paid through loans, and so people have to start paying back when they start practicing. Fortunately, in Portugal, this is not the case, but in other markets, this happens. And compassion fatigue as well, and moral and ethical dilemmas. So all of these basically are the more common triggers that cause this situation nowadays. Okay. And obviously human and animal suffering as well. So all of you have experienced some of these issues, and what's interesting for me from a trainer point of view, and from someone who's now working in this field, which was not my goal in the beginning. I was working with communication skills and all that, but further and further I'm going deeper into the mental health aspect. And what's interesting for me is that we've all experienced this, and some people deal very badly with all of this, some people deal with very well with all of this, and so something happens differently in different people, and that's where I think we can actually do something individually. Then we will talk about the collective part. And so there's two approaches. We can do this individually. We can work on ourselves as a person in a way, and we could do it collectively. And collective actions is like the one we did in Brussels last weekend. So it's moving forward change and trying to implement policies and measures throughout the sector that actually change things and actually make a difference in people's lives. But individually, there's a lot of work we can do. Of course, none of them work by itself, and there are actually studies that try to look at if it was an individual issue or a collective issue. And of course, the answer is it's both. And but those studies, for example, bring the notion that some organizational interventions are easier to implement and have bigger results than trying to focus on individual interventions. So this is interesting from the organization point of view, that sometimes little changes in the environment can have a huge impact. So individually, I usually compare emotional management to cat food, in the sense that nobody has found the recipe for cat food that works for every cat every time. So emotional management is the same. If we had found the solution for everybody dealing well with veterinary profession, we would have solved this problem long ago. Everybody is different, and so everybody will react differently. And one of the models that I usually use when I'm talking about both communication and emotional management, because for me, communication and emotional management are two sides of the same coin. Communication is what I do outwards, and emotional management is what I do inwards. But I like this model because for me, I'm not a psychologist, I'm not a psychiatrist, so sometimes the psychological concepts are not so easy to understand. And this model for me helps us to understand it like an inflammatory cascade or something, like, the things that we like. And so this model is very useful. So why do different people react differently to the same stimulus? Sir? So we have the triggers that we know, and some people react to it very well, and some people react to it very badly. So what we use to deal with the outside world is basically the information that comes through our five senses, right? But the problem is this information is not going to be used in the same way by everybody, and so the problems start. So we tend to omit information that comes from the outside. For example, when I'm here talking to you, you're not aware of what you feel on your left knee, for example. And now that I speak to you about it, you will feel it. But there are some aspects of the information that comes from outside that we just put aside because it's not relevant right now. I'm focusing on what's being said, and I'm not feeling my body right now, right? So this is very useful because otherwise we wouldn't be able to focus. So it has a function. But it can create problems because we may omit information that was useful. And this is especially important when we're dealing with clients or when we're dealing with colleagues that are explaining to us stuff, and we are eliminating parts of it that we don't think is relevant. And sometimes it is relevant. The other thing we do is we generalize stuff. So this is how we learn. We put together in the same box things that are similar. If I see a dog with a specific pathological skin problem, or for example, if I see a dog with a mouse tail, no, a typical hypothyroid dog, and then I diagnose this animal, the next time I see an animal with a similar presentation, I will think about that. So this is how we learn. But the problem is these generalizations create things like clients are difficult, or colleagues don't know anything about this, or women are like this, or men are like that. So all of these phrases will condition the way we interact with the world. If we think the next visit is a Chihuahua, most of you will think that, right? It will bite. But the problem is, there are very cute Chihuahuas that are very nice, right? And so if the Chihuahua that we're going to see is one of the nice ones, he will receive a vet that was going to approach him like this, right? I can't move, sorry. And so what we think about stuff and about people, now that we're talking about communication and emotional management, what we think about situations will condition what we're going to do with that situation. And the third, I don't want to lose much time in this because I'm already late, but the third element that we do to the information is the distortion. And this is explained very easily with a story I always use, which is, imagine a father and the son that go in the car and have a big accident. And they both go to the hospital. The kid is in a critical condition, and so when they arrive to the hospital, they ask the head of surgery to go do the surgery because the kid was between life and death. And so they set up everything, they stabilize the kid, the field is prepared, and the head of surgery gets to the table and says, "I'm sorry, I cannot operate on this kid because this is my son." And for some of you, this might have sounded weird, right? I didn't give you all the information, right? I didn't say the gender of this head of surgery, and I didn't tell you if we can extrapolate, I didn't tell you the sexual orientation of the dad that was going in the car. So, as I didn't give you this information, your brain started filling up with the rest that is not there, with our history, what we know, what would be probable. So, we think head of surgery historically would be a male, And so the guy, the dad that is in the car with the son would be a heterosexual dad. And so the information doesn't fit. And this is what we do. We create an alternative reality when there's lacks of information, but we don't realize that we do that. It's very useful because otherwise we wouldn't be able to plan tomorrow, we wouldn't be able to create a future. So this is how I can plan my day for tomorrow. I imagine the scenarios that I know and I act new information. I create scenarios. This is also the mechanism responsible for anxiety situations because we create the scenarios that chaotic scenarios for tomorrow. So we do a lot of things with information that comes inside. There's more filters. All of our memories, all of our values, everything that we've been through will dictate how we receive the information. And then the information gets in, and we create what we call the internal map or the internal representation of reality, which now you know that is only by a big coincidence similar to actually what happened, because we removed information, we added information, so it's not what happened, it's just what we interpreted. And this interpretation is when we start, oops, what is this? Well, there's some parts missing. The internal representation, can I go there? No, I can't. The internal representation, I say no, don't move. Okay. The internal representation creates an emotional state, depending on the significance we give to it. If it's a menacing situation, we will have the physiological response, no, and the bodily response, a threatening response. And so that is from where our behaviors will come out. After we do this representation, we give it a meaning, we feel that meaning, and we have a bodily response, and then we react to reality. Okay? So I'm really sad that we can't have the full map. Anyway, so the behavior that should be there in the bottom is the final result of this process, and it's the only thing we see from people. So we're usually dealing with behaviors, all of us, and we have no idea what happened in the meantime or before the behavior, right? So for me, this map creates the distance enough to understand that people are not their behavior, and so we can maybe see past that, okay? I will probably, the map is not complete, I'm sorry. I can send you after the proper map, so you would see the behavior coming out of there. And so for me, this is very useful because when I understand this process, I understand that part of how I deal with the world is my responsibility. Of course, there are some triggers, outside triggers, and we will talk about that, but part of it is how I deal with it. And this is why I think this part is important as well, especially if you're in a leading position, if you need to deal with clients or need to deal with colleagues or students, you need to coach them. You need to be aware that what you think about reality is not really what happens, and so you need to be flexible in your interpretations of what's happening. And it makes you a bit more adaptive and more empathic, I think, towards others as well. And so as a team leader, as a team manager, it's fundamental to have this in mind, and it's also fundamental that you are very aware of your role within the system that you're working in. There's a lot of studies that bring this notion to the center of the discussion. Usually, leadership skills is one of the things that it's very important to develop in a team setting. This study from American Animal Health is a study that started in 2017, and they did a lot of studies. The last studies even included the rest of the team, so not only veterinarians but everybody else. And the recent studies show that changes are happening in the sector. So there are things that are changing, and there are more support being given to professionals, and the results are improving slightly. So the sector is reacting, and I always feel that veterinarians are problem solvers. So we identify the problem, we will find a solution. So we'll just working on towards that. But they bring this concept of what is a healthy work environment, and The healthy work environment for them is supported by 4 pillars. The sense of belonging, so people feel safe at work if they feel they belong to something other than themselves, so they belong to a bigger institution. They trust that organization, and we saw this through the mergers and the buys of the big corporations of the different hospitals, this being affected a lot. So the trust in the organization needed to be worked on again, because from a moment to the other, the person who's in charge completely changed, and so we needed to construct that again. The open communication, the third pillar, and the fourth pillar is one that I'm not going to get into because it's a tricky one, but the time of consult, which means that I feel that I have the right amount of time to do the consult that I need to do. Which means, if you're a specialist, of course, it's going to be longer consult times. If it's a routine deworming or vaccination, it will be a shorter. But the notion to feel that you have or not the time you need is one of the pillars for feeling safe and having a healthy work environment. And this, for me, I always look at these kind of models as evaluation tools. So if you look at this and you look at your team and you look at your organization, you can look and start asking, do I have all of those? Are they all filled? Is there one of them that needs maybe my attention right now? So for me, it's always interesting to look at. There's another study that looks at team relational coordination. And what is relational coordination? Because it's a big name. It's basically the ability of a team to interlink their profiles and their job functions to work in an efficient way. So the ability of a team to coordinate all of their tasks and their jobs between themselves. And they say that this is a basis of teamwork, and it's basically set in 2 different areas. So we have communication for one side and relation for the other. And what they say is that this communication should be frequent, timely, accurate, and solution-oriented, which is not always the case, most of the time. And then relation, in the part of the relation, it should be, there should be a shared knowledge in the lines of what I was saying before, but the knowledge is spread between the team members. Shared goals. If you don't have the same goals as your teammates, this will create problems. And mutual respect. And for me, this diagram also represents an evaluation tool. You can think about your organization you work in and your team and think, if you have all of these filled, if you have all of these elements present in a way that is functional, or if you need to take care of any of them. And so they leave a lot of recommendations in this study. So one of the things they recommend, and it's one of the things I've been seeing a lot as helpful, is that there's a space and professionals for supporting conflict resolution, for example, like psychotherapy and counseling. And one of the things that I do now with the practices is create the frequent meetings, like every 2 weeks or every month, create a meeting where people just gather and talk about whatever they need to talk. It's not a clinical case reunion, it's not a journal club. It's just a meeting for professionals to be able to express whatever there is that they need to express. But of course, these meetings require that in the team or an outside provider has the ability to gather the information that is being brought up and use it to extract something useful. Otherwise, it can turn into a blaming contest to see who did what. So, but what I feel is that sometimes we just need to put people talking to each other in an effective way, and usually most of the conflicts and the problems go away by itself. They also recommend a systemic approach, and this is something that I've seen a lot. People asking me, "Oh, can you come and do a training for my team? They have a very bad environment." And I say, "Okay, but are you going to be present?" And they say, "No, no, no, it's their problem." And I say, "It's usually not." It's usually not. So leadership plays an important role, and so if you want to work with a team or an organization, work with the whole team and the whole organization, which sometimes is very tricky because hospitals are big and don't stop. So sometimes what we do is do half-half, for example, and then try to cross-link the learnings we extract from both teams, but do a systemic approach. Otherwise, if you leave somebody out, either they're already very well worked and they can align with the team, or they will reproduce the same problems later on in time. Then another recommendation that is currently being put in practice is recruiting according to team culture, which is very interesting. If you have a small system and you put an outsider into this system and the outsider has nothing to do with this team, it can destroy the whole team. So the recruitment part is fundamental, to be able to recruit people that are not only aligned technically, but also aligned in psychological profile, in style, in goals in life. So try to do an assessment that is beyond the technical. Otherwise, you can create a lot of problems. And one that for me is the easiest one, but it's rarely done, is involving team members in practice problems. So bringing people and saying, okay, we're facing this problem. We have a profitability problem. We are not making ends meet, and we need to solve this, for example. Only by bringing them can you involve them in the solution. Otherwise, you will be dictating, okay, you need to sell more of this, you need to make more of this preventive medicine. All of this will sound like obligations to them. Otherwise, if we as an organization, we have a problem, then we can solve the problem together. And so it will always come down to communication when we're talking about your role as experts and leaders. And I usually use the Latin origin of communication because I like the meaning of it. So communicare is to put in common. So for me, communication basically is where we can create a terrain or a ground for passing of information in a useful way. And I usually use this phrase to illustrate what happens in communication. So communication happens somewhere between what I think, what I want to say, what I do say, what the others hear, what they want to hear, and what they think they understood. So the possibility of problems is huge. That's what fascinates me about communication, is that we actually need to be very aware of what we are feeling inside and what we want to say and what we want to create as an internal representation in the other person while we're talking. You know? We are constructing, every time we're talking to somebody, we are constructing an image or an idea. If I talk to you about a seal with a tutu dancing in a library, something that you probably didn't imagine before, but as I spoke, you started to imagine it. So we're always creating realities in the heads of other people. And we need to be very aware of what kind of reality do we want to create. And so one of the things I do when working with people, and I think it's very useful, is to use this. Now you have the full model. See, now it's beautiful. The behavior is what comes out of it. And so what I use this model as a communications trainer is we can, if we're working with people, if we have to deal with people, we can use some. It doesn't. No. Oh, sorry. I was trying to use the red button, but it didn't want to go. What we can use is we can assume some filters to deal with people. So we can assume for a moment some truths to see if it changes the way we talk and we deal with people. One of them that comes directly from this model is the map is not the territory. So what I have in my head is not actually what happened, it's just my interpretation of what happened and what I did with the information that was available to me, okay? And this, as I said before, opens up the flexibility of interpretations. We understand that your interpretation is probably as true as mine, and so none of them probably are true, and so we can deal with that and we can find a common ground. Another filter that I like, and it seems obvious, but it's not that obvious, is that we are communicating at all times. And this, as a leader, is very important. every time you get into an environment, even if you don't say anything, you're communicating something. If you're talking on the phone, you're communicating something to the people that are around you. If you go to a restaurant and you see somebody mistreating the waiter, it's not with you, but you're receiving information from that person. Of course, you're receiving a behavior, so you're inferring identity, how do I say? You're inferring from that behavior some qualities of that person, of course, but anyway, we receive information. And so if we are communicating at all times, and the results we are receiving are not what we want, maybe we need to change our communication. Be it nonverbal, verbal, whatever you want to talk. So the general communication. Because the goal of communication is the result it produces. 5 minutes. So we're going to speed up. 5 minutes. Okay, we're going to speed up. So these filters I'm going to pass is basically what I use to work with people and to be more flexible when dealing with people. And I think you as experts could benefit from sometimes trying them on, like glasses, to see if it changes something. Another one that I use is that every behavior has in its origin a positive intention. And this one sometimes is difficult to swallow. But what this means is every behavior, whatever the behavior comes from some intention needing to be fulfilled by the person that has the behavior, right? It doesn't mean the behavior is acceptable, doesn't mean the behavior is nice, it just means that that person had that option right now to fill the necessity that she had. And I give you an example from practice. If you have a client and you want to do a restriction diet test and dietary test, I'm in a room full of nutritionists, I should know this. Well, you do the 6 weeks or 8 weeks of the trial, and then you do the consult to see how it went. And the owner says, "Oh, it went very well. I gave all the time the feed that you gave me, and of course at night I would give her the little treat, you know." And you're like, "Okay, we have to do it all over again." And so if we understand that that little treat had an intention behind it, and we find that intention is because the owner thought the animal was maybe depressed, or it's their moment at the end of the day, something is feeling that behavior is feeling some need. If we understand that need, we maybe can give her solutions to satisfy that need, and they will comply with our recommendations. Does it make sense what I'm trying to say? So the idea is, of course, the behavior can be horrible, and we should convict horrible behaviors. But if we understand there's an intention behind it, we can maybe look past it and respond to that intention, and the behavior will usually change. This is more of a provocation than a filter. I like to use this. There's usually not difficult people, there are just inflexible communicators. This is more of a provocation. I'm not going to dwell on this, but I really believe this. I've never met somebody that told me, okay, now I wake up every day and I decide who I'm going to mess up with today. So I haven't met anybody like that. I only met people that say that somebody is like that, you know, from external point. So this is more of a provocation. And the last one, I think is the last one of this, is respect other people's model of the world and your own. And I have a very interesting story about this from practice, which one day one of our clients asked us if we could leave the consult room for a little bit because they wanted to ask the dog if the dog wanted to put a fentanyl patch. And we said, of course. Okay, we went out, we came back in, and the dog didn't want, they went home, and after a while they came back because the dog was horrible, of course. This story illustrates exactly this. It's much more difficult for me to explain to that woman that the dog doesn't speak, because in the end, I'm not really sure. With me, it doesn't speak. I've never met somebody except that lady that spoke with the dog. But it's much more difficult to explain that the dog doesn't speak than to use that to treat the animal. And so what we did, from then on, we gave the consults to the dog, and the owner was translating everything that the dog said. We managed, okay? But it's important to respect your own model. If somebody comes with an animal that had a fractured limb and wants to euthanize, of course this collides with our model of the world, and you should put a brakes on there, okay? But the idea that some people see the world differently, and maybe you can use that if it's not, you're stressing out, no? I will finish. You can use that to do your job and to work with people in an effective way. Okay, so just to finish up, we have a lot of available resources like WSAVA guidelines for professional wellness. You have this psychological health and safety guidelines from Vet Visionaries, which is more on the organizational side of things, but it's very interesting. We have AVMA, Vet Life, Mind Matters. My experience is that vets don't usually use those resources, so this is why Thank You Vets is creating a new way of looking at this kind of research in a centralized way for people to easily access contents. We have this study, just to finish up. This study is a study done for nurses, but has a lot of an extensive, detailed tables of the problems that they have and how can we deal with those problems and the effectiveness of those measures. So it's very, very, very interesting, and it can be extrapolated for vets as well. And so just to finish up, what are the recommendations that are coming off from literature? Resiliency training, as I was saying, so communications training. Soft skills training for practicing vets are required. Leadership training, coaching skills for someone in the position. Informal leaders, formal leaders, experts like yourself. So be able to coach people that you're dealing with. Mentoring programs from young professionals. Workload management, so reducing surgeries, reducing surgery time, and putting the difficult cases in the beginning of the shift is just a simple measure that sometimes can change the way you live your day. Ensuring the breaks, obviously. Regular team meetings, again, it seems obvious, but you have no idea the amount of clients that I talk with that don't have this because, oh yes, we used to have, but then it got pushed over by something else. So this is very important. Mental health service accesses in-house or outside, and then compensation and recognition of the professionals. And allow me to finish with a simple individual reflection that I would like you to do, which is, why is this moving further than I want him to? Well, what word would I use to describe me as a professional? This is something for you to think. From 0 to 10, how do I grade my communication skills? Am I really good, or maybe sometimes not? How would I grade my teaching, coaching skills from 0 to 10 again? What are my pain points when dealing with students, colleagues, or with owners? What do I struggle with? If I had to choose one, what would be the most difficult part for me? And exactly, which one would I want to act first? Because sometimes the most difficult one is not the one we want to deal with. So which one would I want to act on first? And what could be my first step, and when do I want to do it? So I hope this was useful information. I'm free to answer any questions and talk about more of this in detail. And that was it. You have my contacts. Thank you very much.